The easiest way to remember the McCluster seen in Borehaave syndrome. Borehaave syndrome is sudden or spontaneous rupture of esophagus, and there will be three things, that is CVS. C stands for chest pain. Okay, V stands for vomiting, and S stands for subcutaneous emphysema. Okay, what is subcutaneous emphysema? Collection of air under the skin. Okay, thank you so much for watching. Please subscribe to my channel for such more videos. Thank you. The components of trotter stride that is seen in the condition nasopharyngeal carcinoma. Two important MCQs for nasopharyngeal carcinoma is most common site arises from fossa of Rosenmuller. Another is about causative agent caused by Epstein-Barr virus. Now talking about the components of trotter stride are NPC. So trotter stride is seen in NPC. What is NPC? Trotter stride seen in nasopharyngeal carcinoma and components are NPC. What is N? N is neuralgia. P is palatal palsy. And what is C? Conductive hearing loss. So NPC, trotter stride seen in the condition NPC, neuralgia, palatal palsy, conductive hearing loss. Thank you. So tell me what a human body generally wants: good sleep, good food, and good sex. Yes, you heard it right. There is a syndrome called as Klein-Levin syndrome, and this syndrome is a episodic syndrome in which generally a young male will have these episodes of hypersomnia, hyperphagia, and hypersexuality. So Klein-Levin syndrome has three components in its triad: hypersomnia, hyperphagia, and hypersexuality. The scent triad is that a scent got diverted when a girl wrote him hi. What do I mean by three components? Scent triad, girl means gallstone. Okay, diverted, diverticulosis of colon, and hi means hiatal hernia. So a scent got diverted when a girl wrote him hi. So gallstone, okay, diverticulosis of colon, and hiatal hernia. Thank you for watching. Please subscribe to my channel for more YouTube videos. Hello guys, an important triad, Charcot's triad seen in condition cholangitis. Cholangitis means there is an inflammation in your biliary ductus system. Okay, causes can be many, but one of the important cause is gallstone. Gallstone can obstruct your bile conduction, okay, and that can lead to some infection and inflammation. Okay, the triad components are JEF. What is J? Jaundice. What is A? Abdominal pain. Please remember, abdominal pain will be in right quadrant pain. That will be right quadrant pain will be there. Okay, what is F? What is F? F is fever. So please remember, if there is obstruction, bile will not conduct out. Okay, bile will not drain out. So it will lead to obstruction, and obstruction can lead to jaundice. Okay, if there is jaundice, there can be abdominal pain. Okay, because bile is not draining out, infection is too much there, and if there is inflammation, if there is infection, certainly the fever will be there. So JEF. And there is a pentad related to Charcot's triad. Please comment below what is the name of that pentad and what are the components of that pentad. Thank you. The easiest possible way to remember the Virchow's triad of thrombosis is SHE. S-H-E. S stands for stasis of the blood. H stands for hypercoagulability of the blood. And E stands for endothelial injury. So please remember SHE, SHE, stasis, hypercoagulability, and endothelial injury. An important triad, that is Whipple's triad seen in the condition insulinoma. In insulinoma, we all know there is massive amount of insulin, and we all know by basic physiology, if insulin will be high, glucose level will go down. So first component is hypoglycemia, glucose level less than 50 mg per deciliter. Okay, and we all know if there is hypoglycemia, and hypoglycemia will produce the hypoglycemic symptom. So second component of Whipple triad is hypoglycemic symptom. And how to resolve the symptoms of hypoglycemia? Just by giving simple glucose or sugar we can give. So third component is resolution or relief of the symptom by giving glucose. So three components: first is hypoglycemia, second hypoglycemic symptoms, third resolution of the symptom of hypoglycemia by giving glucose. Thank you so much. The easiest way to remember the Beck's triad seen in cardiac tamponade. Cardiac tamponade is a condition in which there is a collection of fluid around the heart, and in this we see Beck's triad. And Beck's triad has three components, that is MDH. MDH masala, such as MDH masala, very famous company. And M stands for muffled heart sound, D stands for distended neck veins, and H stands for hypotension. So MDH masala. And please, if you like this video, like, share and subscribe, and please share to your friends. It might be helping them. Venous disease is the condition in which there is some problem related to endolymphatic sac that is not absorbing the endolymph properly, that will lead to buildup of endolymph in the inner ear, and that is causing some problems. And there is a triad of symptoms that you can remember easily by TVS. T stands for tinnitus, that will be episodic tinnitus. Okay, V stands for vertigo, and S stands for SNHL. The hearing loss will be SNHL. Okay, TVS. What is T? Please speak it out. Tinnitus, V, vertigo, and SNHL. Thank you so much. The components of MEG syndrome triad is PUF, PAF. P stands for pleural effusion, A stands for ascites, and F stands for fibroma. Please, fibroma is a benign tumor, so do not commit the mistake. F is fibroma, that is a benign ovarian tumor. So PUF, PAF, that is your MEG syndrome triad. The components of Budd-Chiari syndrome. The classical symptoms of Budd-Chiari syndrome is ascites, hepatomegaly, and abdominal pain. And how you will remember this? You can remember it with the mnemonic of ASHA. ASHA. What is AS stand for? Ascites. Ascites is AS. And what is H? H is hepatomegaly, and another A is abdominal pain. So this is the classical triad of Budd-Chiari syndrome. ASHA, ascites, hepatomegaly, and abdominal pain. The easiest possible way to remember the symptoms triad is ANA. A-N-A. A stands for asthma. N stands for nasal polyp. And another A stands for aspirin intolerance. So please practice one more time. ANA. A-N-A. A stands for asthma. N stands for, speak it out, nasal polyp. And another A is aspirin intolerance, or they can write aniside intolerance. Thank you. The components of Trotter's triad that is seen in the condition nasopharyngeal carcinoma. Two important MCQs for nasopharyngeal carcinoma is most common site arises from fossa of Rosenmuller. Another is about causative agent caused by Epstein-Barr virus. Now talking about the components of Trotter's triad are NPC. So Trotter's triad is seen in NPC. What is NPC? Trotter's triad seen in nasopharyngeal carcinoma, and components are NPC. What is N? N is neuralgia. P is palatal palsy. And what is C? Conductive hearing loss. So NPC, Trotter's triad seen in the condition NPC, neuralgia, palatal palsy, conductive hearing loss. Important triad of symptoms seen in Wernicke's encephalopathy that is associated with alcohol consumption. Okay, the components can be remembered by गोवा, और गोवा जाते हैं तो दारू पीते हैं, अल्कोहल का कंजप्शन करते हैं. तो G is global confusion, O is ophthalmoplegia, and A is ataxia. एंड इजीली यू कैन रिमेंबर, गोवा जाते हैं तो दारू पीते हैं तो अल्कोहल एसोसिएटेड हो गया. जी इज ग्लोबल कन्फ्यूजन, जब भी अल्कोहल का कंजप्शन करते हैं तो कन्फ्यूजन तो होता है दिमाग में, तो ग्लोबल कन्फ्यूजन. और जब भी अल्कोहल का कंजप्शन करते हैं तो आपको निस्टेगमस जैसी आंखों में कुछ ना कुछ इधर उधर आंखें घूमती हैं, तो ऑफ्थेल्मोप्लेजिया यू कैन रिमेंबर बाय दैट. एंड थर्ड थिंग इज अबाउट अटैक्सिया. अटैक्सिया क्या होता है? जब भी बॉडी के जो मोमेंट्स हैं उनका जो फुल कंट्रोल जो है वो लॉस हो जाता है. सो लॉस ऑफ कंट्रोल ऑफ बॉडी मोमेंट्स. सो दारू पीते हैं तो वो भी लॉस ऑफ कंट्रोल हो जाता है बॉडी मोमेंट्स का. सो गोवा, GOA.